Welcome to the Momentum Matters podcast, where we have courageous conversations with women leaders. You'll hear about their accomplishments, experiences, challenges, and best advice. If you're inspired by women who have overcome barriers and gone on to do extraordinary things, you're in the right place. My name is Karen Terradis, and I'm the CEO of Social U, a digital marketing firm offering social media management, training, and consulting. Today on Momentum Matters, we're excited to introduce Dr. Amber Clark, the Assistant Professor of Physical Medicine and Rehabilitation at UAB. We'll speak with her about her passion to combat disparity in access to healthcare. Now here's our host, April Benetollo, CEO of Momentum Leaders, a Birmingham-based nonprofit on a mission to advance women in leadership.
Dr. Clark, thank you so much for taking time to join us today. I've really been looking forward to this conversation for a long time.
It's been a pleasure. It's a pleasure to be here.
Thank you. So, as I mentioned before, we're focusing for the month of January on health.
Yes.
2020 was a really rough year for everybody, and both physically, psychologically, emotionally, in so many different ways. And with people making New Year's resolutions and plans for 2021, we thought it'd be a really good idea to focus on health.
Yeah.
And we've invited you here today to talk more specifically about something that I know you're very passionate about, which is some of the groups that are more marginalized in their access to health care and the systemic issues that drive a lot of that. And I know that you are a big advocate for some change in policy around those things. So before we get to that, though, let's help our listeners get to know you and a little bit about where you come from. Your upbringing and your family life are so fascinating. So I would love for you to share what you would like to share about that.
Yeah, so I am originally from Monroe, Louisiana. I am in the northeast part of the state, so about an hour east of Shreveport, Louisiana. Okay. A lot of people, I like to joke, don't realize there are more than one or two cities in Louisiana. Either I'm from New Orleans or Baton Rouge.
Right.
And I'm not. I'm from Monroe, Louisiana. I am the youngest of three girls. My oldest sister is a judge back home. Okay. My middle sister is a physician. She's in Tallahassee, Florida. She's an internal medicine physician. And I am the youngest daughter of Kirk and Zelda Clark. I pause here because when I think about my parents and everything that they have done to invest in me and my sisters, we are the reflection of them. So, both my parents, they were born into poverty, they grew up in poverty, and they really wanted to change the trajectory of our family lineage, of our family line. They wanted better for us.
Sounds like they were quite successful.
Yeah. I think so, yeah. But they really instilled in us hard work, and most importantly, we are a God-centered household, and so they really instilled that faith aspect of life into us, but also, again, work ethic, caring about people, understanding that you're not just here to serve you, you're here to serve others, and that has really made an impact. Mm-hmm. And so that has a lot to do with the reason I'm here today.
And your mother was the first African-American pharmacist in Monroe. Is that correct?
Yes, she was. Since then, there have been, some that have come after her, but yes, she made history with that.
That's amazing. And your father was an entrepreneur and owned his own business.
Yes, he is. He's retired. He worked for Monroe City School Board for 30 plus years. He retired about 5 years ago, but he still has a janitorial service, and any other entrepreneurial interests he has, he pursues that. So,
They stay busy then.
Yes. I don't think he really retired.
Yeah.
He can't.
My father's the same. Yeah.
He can't.
On his third career after his third retirement, right.
Yes, I'd be concerned if he really sat down.
Yeah. So, and I also found out that we have something in common. You were a dancer.
Yes.
In high school and college, all growing up?
Yes, I started dancing at the age of 3. There is a video of me dancing at the bus stop. And again, I was very fortunate and really blessed to have parents and they saw that in me and they invested that in me. I think a lot of, again, who I am, those skills that you learn from dance, discipline, observation, because dance teachers always tell you, right? You look at your classmates, you look at dancers to see if there's something that you admire, there's something that you can emulate, you do that. And
to communicate without speaking.
Yes. So I still did. I mean, COVID has, about 2020, COVID has kind of shut a lot of that down. But up until then, I do teach dance at my church. So, yeah.
Awesome. So you still find ways to have that expression.
Yes.
It's amazing that you even have the time as a doctor.
Yeah, I learned really quickly that even though, I'm in a busy profession, that you can't stop doing the things that make you you, because when you do, that just kind of opens the doors for things that you don't want to happen. That opens the doors for you to lose yourself in the sense that, again, you're not doing things that you enjoy. So it opens the door for your balance to be off. So you have to be centered. You have to be balanced. And that's how you become the best version of you and remain the best version of you.
Yes. Yeah. Perfect. So along your path, if you could just help us understand, when did you decide you wanted to be a doctor? You had these two older siblings that were obviously high achievers also.
Yeah.
But you decided to be a doctor because?
So I knew that I wanted to work in the medical field again. I remember candidly, after I would get out of dance practice and dance class a lot, like I would go to my mom. At that time, she was working at Walmart as a pharmacist, and I would sit behind there and while she was doing her thing. And I really liked what she did, but I knew I wanted more of a connection with people. I was good in science. In this profession, in this privileged position that I'm in, you really get to know people. Mm-hmm. People tell you things that some of their family members don't even know. And I saw that. We also had a family friend, Dr. Cynthia Brown Manning, African American physician in our hometown, smart as a whip, excellent physician. She also was kind of a role model, and I got to observe her. And so it was pretty early on. Like I was in elementary, I was like, I want to be a doctor. Initially, though, in that kind of way where I thought I wanted to be a podiatrist because of dance, and mm-hmm. feet are important. Had issues with my feet. A lot of my other dance classmates had issues with their feet.
Yep.
But then I was like, no, I think I want to go to medical school. So.
Okay.
Yeah.
And what would you say was like one of the big, or maybe the biggest obstacle along that path? Because that is not an easy path.
It is not.
Especially for a young woman of color.
Yes, it is not. The biggest obstacle that I faced was when I didn't pass step 1. So there are tons of tests that we have to take to graduate from medical school, to become a physician, to get licensed and all of those things. And up until that point, like I never had any issues. Like I was always 90th, 99th percentile in my class. But medical school is completely different arena and category because everyone is the creme de la creme. Everyone is the top of their class.
Right.
So that was an adjustment. Not to say I wasn't smart, not to say any of that, but that was an adjustment. But so step 1 is exactly what it is, step 1, and there are 3 parts to the United States Licensing Medical Exam. And I took that exam and I didn't pass it.
Which is not an uncommon thing, right?
It's not. It's more common, I think, than what people realize. But, in medicine, and the people that are drawn to medicine, we tend to be type A, we tend to be very critical people, and we don't give ourselves enough grace. So a lot of times there can be shame around that. A lot of times there can be inner frustration. You're looking at yourself as if something is wrong with you. When we know, and there are studies that have shown, there are multiple studies that have shown that your ability to take tests has nothing to do with your capability of practicing medicine. It has nothing to do with your competency of being an excellent physician. It has nothing to do with how you treat people. So I think that was the biggest challenge. I know that was the biggest challenge for me. Because at insults injury, like I didn't pass and it was like by 3 points. So it was just like even more of a sucker punch.
Yes.
But
almost made it.
Yeah. But I got through it, and I'm here to tell the testament today, and I know I'm not the only one that has gone through this, but again, a lot of times in medicine, we don't like to talk about failure.
Yeah. Yeah.
But that's a part of the journey, and the resilience is overcoming that and moving forward.
And it actually changed the path, right? That you.
Well, somewhat. So, I initially went to medical school thinking I wanted to be an orthopedic surgeon until I did an orthopedic rotation and quickly realized, number one, I hate surgery. I don't like the lifestyle of surgeons. I don't have the personality, because each specialty you learn kind of has their own personality. And I knew that being a physician is what I would be doing, is what I do, is not who I am. Mm-hmm. It doesn't define me. So I knew I wanted to be a wife and a mom. I knew I would have other interests, so I didn't want my entire life wrapped in medicine. And I learned about the field of physiatry, or physical medicine and rehab, actually in the second year, the end of my second year in dermatology. And I loved it because at that time, I was still trying to figure out what I wanted to do. I was thinking about, I like family medicine because I like the longevity that you form and the relationships you form with your patients, but I don't really, want to be managing blood pressure and, diabetes medications, but I love that relationship. I realized I love musculoskeletal system, so I was thinking maybe family medicine or sports medicine fellowship. I loved neurological diseases and trying to tie all that together, but I learned about PM&R, and I was like, this is it. This is it. And I was actually the first person from my medical school, Brown University, to go into PM&R. It was 10 years.
And that's physical medicine and rehabilitation mm-hmm. at UAB.
Yes.
Yes. So tell us about that work. What does your day look like?
Oh, it's awesome. So I'm currently an assistant professor in our department. I recently completed residency. Last year I was the administrative chief resident. So literally I graduated, I ended residency on June 30th. I woke up the next morning on July 1st. Oh, you're an attending now. So it was literally overnight. But my daily practice, I am the stroke consult attending. So I'm the acute care side of the hospital. When we are consulted, rehab is consulted, I see stroke patients. So any type of stroke, and I manage any complications from strokes people may have, whether that's spasticity, whether that's issues with alertness, whether that's bowel or bladder issues. I manage that until we're able to bring them to the rehab setting. In my outpatient clinics, I have musculoskeletal clinics, we call it SpineNet. So anything from chronic low back pain, neck pain, shoulder pain, knee pain, any muscle issues.
Which nearly every person experiences at some point in their life, right?
Yes, and I also practice electrodiagnostic medicine. So I do EMGs is the term for it.
Just like nerve conduction studies? Yeah.
Yes, and then on Fridays I have my stroke rehabilitation clinic. So this is where I'll get new referrals from the community, or this will be follow-ups from patients I've seen on the acute care side of the hospital.
And that must be really rewarding.
Yes. And that was, another reason I chose PM&R. We work with populations of people, and I do stroke. Some of my other colleagues, spinal cord injuries, traumatic brain injuries, general rehab, people get in motor vehicle accidents, multiple polytrauma, broken bones.
Gunshot wounds.
Yes, all of that. And we focus on restoring independence, quality of life, and function. It is rewarding when you are able to shine a light and give people hope in some of the most abysmal situations they may find themselves in. And I think that sometimes you don't often realize how far just kind words, a touch, making eye contact, really listening to people goes, because we don't have a cure for spinal cord injury yet. We don't have a cure for traumatic brain injury. But medicine is so much more than that. It's not about diagnosis and treatment. It's about, yes, the patient may have a diagnosis, but that's not who they are. That may be part of them. What is the entirety of this patient? What can we help them with today?
Mm-hmm. What have your patients taught you about human resilience in their recovery, because it must be just
Yes.
step by step.
I will tell you, and we've had several, it's a spectrum. We have people that it's personality dependent, who are just always upbeat no matter what is going on. And typically those patients do phenomenal, right? They've also taught me how important it is to have a strong support system. And I have that. I know I'm very blessed and very, very blessed to have that in my family. But they've also taught me that regardless of essentially what life throws at them, let them just roll with the punches. And you address it, you acknowledge it. Yeah, in this moment, this 100% sucks. But we get up the next day, okay, let's try it again.
Yeah.
Yeah. And again, and going back, it's patients don't always come to you for the solution to the diagnosis. A lot of them just want to be validated. A lot of them just want to be heard. And there's so much healing in that, in listening, in touch, in, again, making eye contact. Because a lot of the people that we treat, people with disabilities, are often overlooked.
Yeah.
Invisible to people. Yeah.
People are actually motivated to look past them because
Yes.
they have a problem confronting
Yes.
the disability.
Yes.
And being honest about it.
Yep.
Yeah. Yeah. How has being a woman of color impacted your journey? You know, both pros and cons, in your upbringing and your, you know, education, and now in your professional life.
Oh, so many ways. Where do I start? I think it's an awesome privilege to be in this position, to be an African American female that is a physician. While we know that with each medical school class, women are actually outrunning the men, that's not the same as when you're looking at the subset of minorities. It's still, I'll take that back. It's still more women than men, but the numbers really aren't increasing as rapidly as they should be. I don't take it lightly, and when I have patients that look like me and I introduce myself as Dr. Clark, there can be often a pause like, oh wait, you're the doctor? And a lot of them will light up because, again, it's not common to have physicians that look like you. And I'm sometimes there just aren't words to describe that feeling that people know innately that they have someone that can understand them, that can champion them. And that's a great feeling. You know, of course, there are some drawbacks to that. In other cases, I can introduce myself as Dr. Clark, or are you the nurse, are you the tech? Sometimes I've gotten, you know, are you the janitor? And especially in being a young physician, that carries some challenges with it as well, because you're being measured against your longevity or what people perceive that you may or may not know based upon where you are in your career, when in fact you can have an older physician that is right where I am. They may have had one or two careers before they decided to go to medical school, but because they may have some salt and pepper in their hair, automatically they may be valued more, or their opinions or their perceived wisdom may be valued more than me.
Right.
Yeah.
I can see that. So in your work, and some of what I read about you on UAB's website, you are super passionate and a big time advocate for marginalized groups
Yes.
that may not have great access to care.
Yes.
And you spoke a little bit about, you know, some of the more systemic issues that play into that, and how those are manifested in people's health outcomes.
Yes.
And so I wondered what you could share with us more about that work. Take as long as you like, because I know
Yeah.
you're very passionate about it, and how people can help? How can we help to bring about change, either in policy or in just advocacy for those groups?
Yeah, I'd love to. So actually this started in college when I was introduced to the concept of population health. I was a Jackson Heart Study scholar, and the Jackson Heart Study is the largest cohort that studies African Americans and why African Americans are predispositioned to have diseases such as hypertension, diabetes, which leads to all these other chronic diseases. Now we're having strokes. Now we're having amputations. Now we're having heart attacks. All of these things. And again, by that time, I knew I was going to medical school. I knew I wanted to be a doctor, and I wanted to make a change on that one-on-one relational level. But again, when I got introduced to the concept, wait, we can affect more than one person at a time, like from a top-down approach, and making sure we have good policy to support marginalized populations. Oh, absolutely. So in college, I took courses like epidemiology, introduction to public health. We took field trips to NIH, and that's really where it began. And again, kind of followed me through medical school. I ended up taking a year off, and I worked at Lifespan Community Health Services. That experience was eye-opening because I'd grown up in the Southeast, been in the Southeast, so I thought that this particular part of the nation was the only one that was having the issues that we were having, and I was so wrong.
And this was in Louisiana still?
So medical school in Rhode Island.
Oh, okay.
Yeah, Lifespan. So yeah, when I moved up there and I worked for Lifespan in the community office, same thing, right? And even more so because in Rhode Island is very diverse, number one. And so we're having like the Lao populations, we have Portuguese, we have, a huge Spanish population up there, and we have a lot of different African populations up there. It's the same thing. People don't have good access to care. People don't have good access to housing. They don't have access to everything that plays into health. And then they're punished, right? They're stigmatized because of things that they cannot control to an extent. Because there's some things that everyone has control over, and I want to make that clear. I do think that we all have to take responsibility for what is within our control. And that was actually, so I was Miss Black Rhode Island, USA 2013, and that was my platform.
Say that, you just brushed right over that. Say that again, Miss Black Rhode Island.
Yeah, USA 2013.
2013.
Yes.
Nice.
I did just blazed right through that.
Yeah, I see it with that award-winning smile that you have. Yeah.
Thanks. But I really wanted to focus on teaching patients how to advocate for themselves. Because, yes, you go to a physician, yes, you ask their professional opinion, but I can only speak for myself. I don't practice paternalistic medicine, as in the physician is always right, this is what it is, I expect you to do what I say. This is a partnership. I have my responsibility, you have your responsibility. So with that, I really encouraged people, number one, to go in and ask questions. And I know there's pressure from all sides. Physicians have pressures to get in, get out. Patients may feel pressure, I don't want to keep them, I don't want to bug them. It's not about that. Have you write some questions down before you come in. You can rank them, the most important things that you want, because want to know, and go from there. You have a responsibility as well as the physician. And to really read. I understand that, there are some issues, however, with that, because just because you are intelligent doesn't mean that you're health literate. It's literally an entire different language.
Yes.
And we had efforts working on that when I was working with Lifespan Community Health Services. We really had programs geared towards improving health literacy and making things easier for people to understand. But at the end of the day, everyone has a part to play. So from there, I kind of started getting involved in National Medical Societies, the American Medical Association, who is kind of the voice of American physicians. when we're talking about policy, when we're talking about change, anything that affects the way medicine is practiced. And that followed me to residency. And it was awesome because not only did I get to layer that passion for healthcare disparities within, African American populations, Hispanic population, all of those, now we have an even more marginalized population, people with disabilities. And then when you layer race and ethnicity on top of a disability, it's even more marginalized and people receive even more disparate care. So I really have sought out all types of opportunities to speak out and get involved, trying to kind of mobilize, at that time, my co-residents. I actually just finished, it was a virtual class, but because of, COVID. It was from George Washington University, and it was a health policy course. And they have an outstanding health policy course, 3 weeks. Learned everything, kind of crash course of health policy, from insurance, Medicaid, Medicare, how those have been written into law, to how you can lobby, to how you can advocate, all of those things. It is a work in progress. My ultimate goal is to be an expert and the go-to person when we're talking about healthcare disparities, when we're talking about people with disabilities, and really be a voice of reason and someone that people trust to speak the truth. People trust that I'm choosing people over politics, because I think that a lot of issues that we are seeing on the ground level are because we have not chosen people over politics. So many systemic issues that affect the way people are living. People don't choose to live in poverty. People don't choose to have to determine if they're going to pay their light bill or pay for their medicine or buy groceries or buy clothes for their babies. That's not a life that people just wake up one morning. I think today is the day. Today is that day I want to make those decisions.
Yeah.
But it takes a change of heart. It takes, I think, a change of leadership. I think it takes new, motivated people that are full of this same passion, people that value people as people and can actually see them for who they are, not put your preconceived notions and judgments on them. And I think that that's truly my experiences and what I've had to go through have truly fueled that, because I was also bullied, and so really bullied junior high, high school, college. And I never want anyone to have to go through that. So.
Well, and your family is living proof.
Yes.
Of, I mean, your parents, you shared with us, were born into poverty.
Yeah.
As African Americans in a highly charged,
yes,
racist,
yes,
environment.
Yes.
And era.
Yes. 60s.
I mean,
60s.
Yeah. That is, you talk about not choosing.
Yes.
And to have made the conscious choice to invest in their 3 daughters the way they did, especially that you're just girls.
Yeah.
There are many parents who would not have made that choice just
At
solely
all.
based on the fact that you were girls.
Yes.
So it's really meaningful to me to think about the privilege that they didn't have, but they were actually able to create.
Yes.
For you.
Yeah. And we talk about parents all the time, and if you talk to either one of my sisters, like the true definition of sacrifice, and again, realizing that you are not here just to live your life for you. You are here to serve others and to make the path a little easier, a little better for someone that's coming behind you. I think a lot of people are kind of stuck and paralyzed in the thought that because I had to go through it, you're going to have to go through it.
Yeah.
No, that's not to say that you won't have to work, but some things are just not necessary.
Right. Right.
It's not. And if you can help someone avoid the mistakes that you made or help someone avoid the pain that you had to go through, why would you not?
Right.
Yeah.
Yeah. Well, Dr. Clark, thank you so much for being part of this discussion today and for contributing to our podcast. I hope that we will have an opportunity to bring you back again.
Absolutely. I would love to be here.
Yeah.
Thank you so much.
We'll find some ways for you to plug in through Momentum. We have a fantastic mentoring program, and perhaps we can do a future webcast on some of these topics too, because I think a lot of women, young and old, at any place in their career would find what you have to share very inspirational.
Well, thank you. And again, thank you so much for having me on here. This was excellent.
Awesome. Thank you.
Excited.
Yeah.
Thank you.
See you again soon.
The Momentum Matters podcast would not be possible without our sponsors. Please visit our website, momentumleaders.org/sponsors to learn more. Signing off, this is Karen Terradis with Social U.